Hartmann here with you, and super happy to have in the studio Alex Lawson of Social Security Works, socialsecurityworks.org. He's the executive director. You can tweet him at ALAW202. What a novel Twitter handle. At, Alex Lawson. Although, if somebody types in Alex Lawson, does your name pop up? Are you
on Twitter? I think ALAW202 is easy. On on Facebook, Social Security Works is the one to find.
Okay. The reason I wanted you on is Alex, is that over the last couple of weeks, I keep getting calls from people who have very specific questions about, for example, Social Security disability. We had, it was Mick Mulvaney last week, who was on one of the Sunday shows. It was a week ago Sunday, who said, yeah, most people don't realize or don't think of Social Security disability as Social Security. So if we're going to cut Social Security, we can start there.
Right.
I mean,
That's their favorite. That's their favorite.
He didn't use that exact phrase. He said there's a lot of waste there or something like that. But, that was basically what he was saying. And so, somebody had a question about that. Somebody had a question about Medicaid, about Medicare. So if you have a question about single-payer health care, about the state of Medicaid, about the state of Medicare, about what's going on with all this stuff, about where we're at, about where we might be going, about what legislation is being proposed, about what Social Security Works is doing, give us a call. The number is 202-808-9925, 202-808-9925, and Alex is here in the studio and can take your calls. So, while, assuming folks call in and have questions, let me get started, if I may. What is the current state of Social Security, Medicare, and Medicaid? Each one of these programs has a trust fund associated with it, a budget associated with it, a constituency associated with it, and all three of them, we have been told by Republicans, are on the verge of completely collapsing. What is the reality?
The opposite of what the greedy liars on Wall Street push, always. Let's start with Medicaid, because I think we saw something really interesting there in this fight on Trump care.
Okay, let's define Medicaid first.
So Medicaid is a program, and most people think of it because it does provide health care for people with lower incomes, for poorer Americans. But that's not all that Medicaid does. And I think that a lot of people learned this go-round that Medicaid is also, if a lot of people knew this, but a lot of people learned, is the largest provider of long-term care in America. So that is nursing home care or home health care for, people who are too old and need 24-hour care or are facing a disability that also needs 24-hour care. When I say too old, what I mean is oftentimes family are taking care of parents, right?
Now my cousin had a situation, one of my many cousins, where she gave birth to a child with spina bifida, or spinal cord was exposed. And she lived until she was about 20, I think. And she never even acquired language skills. She was just profoundly disabled. Unable to speak, basically lived in a diaper, needed to be cared 24/7. And my cousin was paid by the government to care for her daughter. And I believe that was Social Security disability, or was that Medicaid?
It could be in specific cases, and I'm not exactly sure, but it could be parts of all of them.
Right. And it wasn't a huge pay, by the way. It was basically minimum wage kind of,
But it's a good entry point into this discussion too, because prior to Medicaid, and definitely, playing Social Security disability plays a role in this as well. But prior to Medicaid and under the plan that Trump Care was proposing, your cousin's child would have been institutionalized. There was no other option. And without Medicaid, millions of people with disabilities and people whose families can no longer care for them, not because they don't want to, but because 24-hour professional nursing care is needed, right? That's what I think people miss. The only option was institutionalization, and Medicaid allows a lot of families to actually have more independence, dignity, allows people to age in place, or people with disabilities to stay with their family. Those are all really great parts of Medicaid. Dr. America was sitting in this chair when I was guest hosting, and he was talking about, the other part of Medicaid, which is children, a huge children's program. And it's a wellness program, right? Like, it's not a sickness program. It is actually dedicated to increasing wellness, to monitoring wellness. And that is something that is really missing in a lot of the programs. In a lot of our, insurance programs, they don't care. The business wellness programs that you are offered at work, say, if people don't know, those are actually just ways of getting your data from you, so that they can more accurately charge you higher premiums if they figure it out.
Or sell your data.
Or both. Right? These are the greedy liars on Wall Street. So my point on Medicaid, though, was I really do think there was a knowledge that was acquired during the Trump care fight that, especially on long-term care, Medicaid is the largest provider. 70% of Americans will need long-term care. Without Medicaid, there is no system at all. And we're talking in nursing homes, $97,000 per year on average. On average. So this is not actually just for poorer Americans. Lots of middle-income families, once they've exhausted their resources, it is Medicaid that is going to allow a person to get that 24-hour.
Now, what about the clawback on Medicaid?
I'm not actually that sure on that specifics of it, so I can't really speak that well up to that.
So you said that's Medicaid, Medicare and Social Security.
So Medicare, which was also attacked in Trump care, it rated it for $117 billion. That also helped turn the tide on it. Medicare is basically single payer health care for older Americans age 65 and up, and Americans with serious disabilities, and a few other situations, specific situations. But this is a healthcare program that is actually healthcare, right? It's not just health insurance. It's providing healthcare for Americans, and it's massively popular because of that. Once a person moves out of the Kafkaesque nightmare bureaucracy of the private health insurance market, at 62, 63, 64, where people are facing some of the most complex health issues, and then they make it into Medicare, it's oftentimes like crossing a finish line because it's like, finally, I've got Medicare.
I can tell you from personal experience.
And that's why, what I think happened a little bit, people love Medicare. And I think during this fight, I think Medicaid got a little bit of that protective nature as well. Maybe I'm hoping that happened, because these are two parts of a system. And if one part goes down, the other part will as well. You can't actually you can't do Medicare if you just destroy Medicaid, because of the millions of people who are on both of them, called dual eligibles.
These programs interact with each other, interface with each other, and many people are using both. And we'll get into Social Security after the break. Alex Lawson is with us. He's taking your calls. If you have questions about Medicare, Medicaid, Social Security, Alex is the Executive Director of SocialSecurityWorks.org. We'll be right back.
This is the Thom Hartmann Program.
And you can tweet him at ALaw202. Be right back.